Okay, there we go. So let's see how it sounds now.
You're unmuted.
Okay, thank you, everybody. It's much better, right? So Knollwood is a 62 plus community. Many of you may already know that, but we are a life plan community located in Northwest DC. We were founded by the military and guided by the military and intentionally originally for the military. In the past few years, we've broadened. So there are non-military living at Knollwood as well. The majority of the community is independent living residences, but there is a small assisted living and skilled nursing neighborhood at Knollwood as well. In fact, we're very well known for rehabilitation and frequently can even accept non-Knollwood residents for rehab. So that's another good thing that some of the providers present might like to know. Our location is magnificent. If you haven't seen it before, we are smack dab on Rock Creek Park. So a beautiful setting. We're in a quiet residential neighborhood. So it's just a wonderful place. And you can always find out more at knollwoodcommunity.org. Thank you.
Awesome. All right. Well, thanks so much, Carol Ann. And that slides Paul Bricker into the driver's seat there. And I say we get this program started. Paul, what I'm going to do is, let's see here. Let's make sure that we can display your slides. So I've got them. Let me know if you want me to do them or if we were going to have Laura do them.
Okay, Laura's going to put them up right now. Okay,
great. And once we see that those slides get up, I'm going to back behind the curtain. And before I do that, what I want to encourage the audience to do is you can ask as many questions and make as many comments as you'd like. And where I would prefer that you do that is in the Q&A box, okay? Because as I can already see, chat is going crazy with you guys connecting with each other. And if you put in any questions and comments in the Q&A box, then I will make sure that we address them. And Paul, are you okay if I as you and your team are going through this presentation, if a relevant question comes up and you sort of pause, is it okay if I jump in and address those then?
No, absolutely. And I would encourage, as our viewers want to ask questions, ask the questions so we can address them. Awesome. We want this to be a helpful session. We want to share. We're going to be completely transparent with you. We believe this is really important. And if we can help others with our experiences, that's great, because ultimately we're not out of the woods when it comes to COVID. And we're going to face this enemy, and I'm going to call it an enemy because I have a military background, in the fall. And if this is helpful to those others who focus on senior living and taking care of or providing an environment really for older Americans to be safe, then that's why we're here, Steve. And we appreciate the opportunity to do it.
Oh, I love it. And I've been looking forward to this for a few weeks now. So I'm going to drop off the screen, but you may hear my voice popping back on. But thank you to Paul and the team at Knollwood, and audience. Make sure that you participate in this discussion today. So take it away, Paul.
Thank you, Steve. And again, thank you, Steve Gurney, and thank you for the community that's there for giving us an opportunity to share our lessons learned. We're going to call them lessons learned. As a background, I'm a retired Army officer. I've been here as the Chief Operating Officer for over 3 years. I viewed COVID as the enemy. I faced the enemy in Afghanistan, and I faced the enemy in Iraq. And many of the ways in which we approached dealing with COVID was the similar way that we approached in war, when you're dealing with a killer, and that's what COVID is. But so we're going to run through, this is our timeline. After we run through the timeline, and there'll be a number of photos that will show you that we were going to illustrate some of the things that we did. and some of the folks that are on our team and what they did. And then we're going to go into summarize lessons learned as it applies to testing. There are other things that we've learned a lot. I think everyone would agree that COVID is probably the biggest challenge to not only affect senior living, but our nation, if not globally, for the last 100 years. So in my lifetime, this is the biggest challenge that we've faced. And for us, for leaders right now involved in senior living, it's a huge opportunity, and the stakes are really high, because at the end of the day, if this virus gets inside your community and you're not prepared to protect your residents and protect your employees, and you haven't put in place all the tools that are available to you, and we believe testing is the most crucial tool, then you're at risk. And so you take that as it is as I walk through this. So I want to kind of give you a timeline. I'm going to primarily focus on April and May, but in order to lead to April, obviously I'm going to go back to March. Early on, when we watched the virus as it broke out at a nursing home in Washington State, we watched it pop up in major population areas throughout the country. And then it came to New York. And once it got to New York, we really started to see the outbreak there. We immediately knew that we needed to establish a clinical review board through which the boss and I would process all operational decisions. So we pulled our medical director in, my director of nursing, my administrator, and my infection control nurse. And we stood them up as a standing board. We called it the COVID Review Board, or the CRB, and all operational decisions we started to run through them. Even though traditionally they were primarily focused on skilled nursing and assisted living, now because we're one community, we're one house, and in order to protect this house, we needed to ensure we had the benefit of taking advantage of the clinical expertise that they bring to the table. Two of the other folks on this panel today, Margot, she's my clinic nurse. She's a registered nurse. She has decades of experience, and Arlette is my director of nursing. So these are two registered nurses that I am going to call superheroes. These nurses are similar to the infantry soldiers that we worked with in Afghanistan and Iraq, because when it came down to it, they're the ones that led our team to protect our residents and our employees at every turn. They were tireless. They would don PPE, and they would go in and they would demonstrate through this whole process to the rest of my team and to my residents how committed we were to them, and it built confidence in my team. So for my nursing team especially, these two I put on pedestals. They are truly heroes. So they were part of this clinical review board. And as we went through this, we began to really realize very quickly, we started to hear this word asymptomatic. You know, before COVID, I didn't know what asymptomatic meant, okay? But asymptomatic really helped us understand just what a danger this virus is, because you can't see it. So we began to see employees starting to get flu-like symptoms, but you know, do you have COVID? Do you not have COVID? We're working with the city, and you know, we listen to the CDC, we listen to the briefings every day on the news, and we talk to the Department of Health. And really, at this point, as we end into March, I've got some employees that are sick, but you know, it's the flu. And we continue to have challenges with understanding just the nature of this virus, and we watch others. And then in early April, one of my residents who we lost in skilled nursing, we got a call from the medical examiner literally early in the morning on a Tuesday morning, and they said, this resident tested positive for COVID. The medical examiner, after she had died, had tested her, and she had tested positive for COVID. And then we were like, well, what do you mean she tested positive for COVID? She didn't have COVID symptoms, we thought. She was older, and she had some comorbidities, and we just didn't see this coming. And at this point, you know, we've shut down the campus. We're not allowing visitors to come in. We're doing everything that the Department of Health and CDC are telling us to do. We're ordering PPE. We think we've got that under control. And lo and behold, though, then the week before Easter, 5 more of my skilled nursing residents begin to have symptoms, okay? So we begin a very intense dialogue with the Department of Health. I'm hearing more and more about the asymptomatic nature of the virus. 80% of the people coming up with the virus are asymptomatic. And this is beginning to resonate with our leadership team. And then we have 5 residents that are beginning to have symptoms. So we want to test them. But I said, not only do I want to test them, I want to get the director of the DC Department of Health on the line. I want to have a conference call with her. We want to test everyone. I want to test all my residents in skilled nursing. It's only 57, and all my employees who work there, it's about another 70. I want to test them all because I really need to understand what we're dealing with here. So on Thursday before Easter, I have a conference call with the DC Department of Health, Dr. Nesbitt, and we have a number of other people on the call. And Dr. Nesbitt says, you can do whatever you want, but we will only test symptomatic residents, Mr. Bricker. And if you want to test anyone else, you can, but we're not going to help you. We can test symptomatic residents. She wouldn't use that term. She just said, we don't have the capacity to test anyone other than symptomatic residents. So the call was finished. I felt very defeated. My team felt defeated because we had instinctually, we knew there was something more here to this. At that point, though, we had not, other than the one resident we'd had that we lost, that we found out from the examiner, that's the only COVID we thought we had. So I immediately started calling, and I got a hold of LabCorp, and LabCorp said, okay, you guys take care of veterans. We understand what you want to do. We want to be supportive of you. We didn't even have a lab account with LabCorp. Overnight, they established an account with us, and she committed to shipping us 150 kits that would arrive on Monday. We had also been in contact with the Center for Disease Control in Atlanta. They knew about us because we take care of, so our campus, we serve retired officers of the uniformed services and their families. We've served members of Congress before, but these are folks who've served their nation their whole lifetime. And like others, there's an interest in ensuring that these veterans are taken care of and that they're getting the best possible care. So we were talking to CDC, and CDC came and said, we're going to come to Knollwood and we're going to look to see to what degree we believe, are you doing everything right? So on Easter Sunday, CDC showed up. We met with the CDC, Department of Health showed up. I brought in Dr. Eric DeYoung, and I think, Steve, he has also spoken on one of your sessions before. Eric is an exceptional physician from Capital Caring, and we had contracted with him to come in and help us with testing with his nurse practitioners. We put together a plan. On Monday, the tests arrived, and on Tuesday, my clinical team went down to my skilled nursing area, and we started testing everyone. We tested all the residents, and then we went outside and we started testing all the employees that worked in skilled nursing, any of them that worked in environmental, all those that worked in dining, porters, anyone who had any contact with any of my most vulnerable, which is my skilled nursing community. Literally 18 hours later, when the results started coming in, it was our worst nightmare, okay? From that initial battery of testing, we had 11 residents. The city also contacted us and said those 5 that were suspect, they had tested positive. So we went from 0 to 18 residents overnight being hot, and 13 of our employees, okay? And then as we continued to test, as the test results continued to come in, we were literally sending the employees home, told them, go home, you need to stay at home, contact your doctor, we're gonna continue to pay you, we don't want you worrying. 30% of our workers work at other communities in the DC area, okay? These are the hourly CNAs and LPNs. And we had been successful getting a paycheck protection loan so that we could afford to pay them. So, and then we literally started shifting employees to cover the shifts for the most vulnerable. And this is where Arlette was focused on care and moving residents out of semi-private rooms to private rooms. It was nonstop. Many days Arlette was working 16, if not longer, hour days with her nursing team. Margot's focused on testing, and it was just relentless. And we just continued to test. and up until the 1st of May. And then when we got to the 1st of May, we had contained the virus. We had our last resident on the 1st of May that we contracted the virus through a private duty that we had found through testing in assisted living. And that was the last resident that we had who had contracted the testing, contracted the virus. And at that point, since then, we have been virus-free at Knollwood. So we're now at 9 weeks with no residents with the virus. We feel strongly that testing informs all our operational decisions. We're testing all our environmental services and skilled nursing employees every week, as well as our residents and staff that work in assisted living. And I've tested 100% of my independent living residents because I needed a baseline to ensure it hadn't gotten into independent living. And sure enough, we've protected it. So since May 1st, we have not had one case with a resident. I have had 2 cases with additional employees, but we've contained it, and we test then any resident or employee who may have been exposed. And at this point, we've had no spread of the virus. And I attribute this to an aggressive testing program. We've now administered over 1,800 tests. So in the testing, you're only as good as your last test, because with testing, you're looking in the rear view mirror. Okay. So it continues to require masking, washing your hands, keeping your hands away from your face, social distancing. And it's truly a way of life now here at Knollwood for not only my residents, but also for my employees. And again, we treat everyone here like a family. And as we protect this house, we have to follow these guidelines, and testing really helps us. We also have an Abbott Rapid Now tester here. And so we can do on-the-spot testing for if we have any suspicion of someone may have been exposed, and we follow that up with a LabCorp test. So we have a very aggressive testing regime here. It's worked for us, and it informs all operational decisions. So I'd like to now move on to lessons learned, okay? And so for our lessons learned, so for the purpose of this, we tried to share with you the lessons we've learned through the testing, okay? So we do 100% screening. Anybody comes in the door here gets screened with a temperature check, and we do random COVID-19 testing. Anytime an employee comes back from vacation, we're gonna test them. We've started to not only order enough personal protective equipment for our staff, but testing consumes an insignificant amount of PPE. So now we've built the stockpile so that we'll be able to, as we head into the fall, we'll be able to take care of our PPE requirements. Again, we test residents and employees every week who in skilled nursing and assisted living. Because they're so vulnerable, we have to ensure that we know with certainty that the virus hasn't gotten in and affected any of my residents. Private duty aides, okay, this is one that I would encourage anyone who runs a senior living community. Private duty aides, I have nothing against private duty aides, but they have to be tested. Nobody gets to a resident that's not gonna be tested. And the closer you are to a resident, the more testing you should expect. These tests are all voluntary, so we don't force anyone to take a test, but if you're an employee and you wanna work at Knollwood, you will agree to it. And then also if you come back from an ER visit or an overnight stay at a hospital, we're gonna test you. Our visitor screening is robust and it's rigorous. We've created permanent positions for healthcare screeners because I akin visitors that, so we used to have many places you could come in Knollwood, no longer, only 2. And those I almost call akin to in a fire base when I was in Afghanistan or Iraq, that main entry control point, that is a seam into your community. That is just the same way we treat that when you come in to become a visitor at Knollwood. You have to process through screening. We're gonna ask you some questions. We're gonna take your temperature, and we make an assessment right then and there on whether or not you're gonna be allowed to come into the community. Residents clearly are, this is their home. Everyone else, though, we have strict protocols, okay? And then again, masks, social distancing, everything the CDC and the smart medical clinical community that's been helping us with this virus, we follow their instructions. Our healthcare workers are truly the infantry soldiers of the war on COVID. And I cannot thank them enough. They're truly heroic people that have done tough stuff. They've faced down COVID, and in many cases, they've faced down death. And they've demonstrated to my team that with appropriate PPE and testing, you can go in there and you can beat this. So I really want to stop there, Steve, so I don't take up any more time and we can move into questions.
Man, this is awesome, Paul. Great overview. And we do have questions coming in, but I wanted to just let you roll on this. So let's see if there we go. Good. So we got your smiling faces there, and so folks, I'm going to start going through the questions and comments, but as an option, if you'd prefer, as opposed to typing a question or comment or something you'd like to share, you can raise your hand and we'll mix it up. Okay. So Ardell Fleeson says, hi, Colonel Bricker, can you take us, well, you sort of talked about this. Can you take us from the very first whiff of the enemy you got, the approximate date, and how did you huddle to come up with the early combat measures? Boy, she must, I think Ardell is got a military background. Did you have any level of panic, and how did you rechannel that energy?
So, this is where dialogue and collaboration with my nursing team, with my medical director, with the boss, you gotta leverage the skills you have. And we've got a wonderful clinical team. And we watched the news and we watched the press conferences, and the asymptomatic nature of the virus is really what perplexed us. So we knew quickly that testing was going to be a tool in the toolbox that we needed, and we needed it badly. So we weren't willing to accept no for an answer. The institutions who provide oversight would only do testing for asymptomatic folks that were symptomatic. And every day I continued to listen to these experts tell us that 80% of the folks are asymptomatic that are shedding the virus. And we found the same thing. We found 80% of the people that we tested, to include 90-year-old folks in skilled nursing, asymptomatic. And they were shedding the virus and they didn't even know it. And you would never know it by just watching them and watching their patterns of life. So the only way you can protect your people is to test them, okay? And then you're equipped with the knowledge to make a sound plan, and then you got to move out quickly, and then you have to ensure that you can follow up. So we test every week here, and I know this is about testing, and I can't emphasize enough. Testing is one of the tools. You have to social distancing, staff being very disciplined about wearing their masks, gloves, keeping their hands away from their face. The staff live in the communities where we work, and they come in every day, but that's why they have to be screened and tested. So let me ask Margot. Margot, is there anything you'd like to add?
Can you hear me okay?
Absolutely.
Okay, good. Every day from the very beginning up until about a week or two ago, we've met daily for a conference call, and that has really helped. All the members of all the directors would get together on a conference call and discuss any updates, infection control rates, PPE rates. And we literally had one director for each area that really needed to be addressed on a daily basis. We had someone that was always out shopping for PPE online. Our lawyer for Knollwood was able to find a lot of PPE for us in the beginning, which really, really helped. I never felt, except for in the beginning, I never felt that we were lacking in PPE. And PPE for me was the most important, because you have to protect yourself in order to take care of people. So except for the very beginning, I really feel like we've had enough PPE, and I'm sure Arlette can definitely address that, because she worked in the skilled nursing facility daily where the positive patients were. So she probably could speak more about the PPE. But testing has really become the focus of my job duties on a daily basis. Every day, probably 5 or 6 times a day, I'm looking for results to make sure that we don't have any positives coming back. As soon as we get a positive, or if we did get a positive, we made sure that all the directors knew, and we acted upon it, and we did contact tracing. So I think working as a team and directors being very faithful to and loyal to Knollwood and making sure that everyone was safe has really helped us.
That's great. Arlette, did you want to jump in and sort of add some comments? Again, the questions are coming in fast and furious, but I'd love to hear your reflection.
I just want to start by saying that Conor Bricker likes to talk to about his nurses as heroes. We were able to find this enemy because of his diligence and his refusal to say, I'm not going to have tests for my community. If we had waited another week, we could have had triple the people that were positive with this virus. So our true hero here is Conor Bricker. Then we took over taking care of the people that we were able to find. The true, finding the asymptomatic resident and staff was a blessing to us because we were able to contain it to only one area versus having to deal with this in all the different areas. And I think they addressed the other important things. The general, just making sure that we had a meeting every single day and then reporting. And then you could hear from the leadership, you're doing a good job. Keep doing what you're doing. You're doing a good job. And it helped us just go out there and do what we knew to do.
Man, you know, I have to say, I'm sort of glad that my my video isn't on, because as you just sort of recited that, I had tears in my eyes. This is just a wonderful story of protecting our elders. And but we got a question from Angela White, and I think this is a really good one. She says, what are your thoughts about employees and clients being tested before reopening senior centers and adult daycare centers? And I'd add another institution to that. I'm curious on your all's thoughts is that, is it possible to take this approach in other settings that are not senior living? And I think there's probably a lot of parents out there who, man, if Knollwood was the school that their kids were going to, they would sleep a lot better at night. Any sort of thoughts on the other senior living providers and employing a process similar to this one?
So Steve, this again, I'm not going to criticize anyone. I look at this like, if you don't test and you serve the most vulnerable population, or if you serve any population for that matter, and you don't test, then you are really, in my mind, that is an egregious error. Okay. That is, that's almost akin to being gross negligence, okay? Because you can't see this virus unless you test. Maybe in the future, technology will emerge that will enable us to have a better understanding of to what degree it's gotten into your area. We use pulse oximeters, on residents to monitor oxygen levels. We were paying attention. We were in communication with the CDC, Department of Health, nonstop. The CDC was very interested in our testing because there's not too many skilled nursing campuses and assisted living campuses in high urban settings that have been COVID-free for 9 weeks. So, we have wonderful people, but testing is what enables us. It gives us the knowledge. And those calls that Margot talked about every day, Monday through Friday, and on the weekends and holidays, 12:30. They would go on for 30 minutes to 60 minutes, but that's where, and we were a flat organization, and I would encourage organizations, share information until it hurts. At some point when you're in a crisis, you've got to be willing to trust your people. And so you need to really instill in them that amount of trust, share the information, give them the knowledge, tell them what needs to be done, and turn them loose. Because literally this virus, you're racing the virus. We would literally be racing to test to try to stay ahead of any additional to be able to contain it, okay? We didn't want any more. Our goal was to always stay ahead of it. So in that one situation in assisted living, a private duty who was a replacement for another private duty who had come in to serve one of my residents, we tested her. We would not have tested her had we not been doing compulsory testing. So we tested her the next day, and literally in the beginning, LabCorp was really fast. Now it's gotten bogged down because so many people are testing. But we got the test results back at Friday afternoon at 3 o'clock. My nursing team jumped into action, jumped into PPE, and they tested 100 people on a Friday afternoon. The next day, we knew to what level the virus had gotten into our community. You have to be aggressive, and you have to have people that are willing to really, this is not in textbooks. What we've been doing is writing textbooks, and the information that we've learned needs to be shared, and we're sharing it with us. That's why we do things like this. Because at the end of the day, we don't want people to have to learn those same things we did. The next time they'll be better equipped with the knowledge and the testing, and then hopefully they'll be able to protect the residents. My child would not be going to a school that was not doing testing. My mom will not be going into, and my mom I think is watching today from Northern Michigan. She will not, I will strongly discourage her from going any assisted living or long-term care campus at some point if she ever wants to, that doesn't have a strict testing regime. And there's no exceptions. The boss and I, we get tested, so the highest folks you want to come in the door, you get tested. Nobody's, trust but verify on testing for everybody.
That's great. Let's see, Ann and Brooke have their hands raised for a while here. So I'm going to start with Ann. Ann, can you?
Yes, it's an excellent idea. I live in Asbury Methodist, which is a huge community. And I think it would be wonderful if we could have this. The best thing we do is test temperatures of everyone who comes in and out, and everyone wears a mask, everyone. The testing would be ideal. I think it would give a great deal of confidence to many of our members who really are still extremely afraid, very afraid. So thank you very much. I'm glad to have the witness from Knollwood. Keep it up, Paul.
Yeah.
Congratulations, hon. Bye-bye.
Thanks, Ann. We love having our elders and folks, not just providers, on these calls. It's great to be informed. And Paul, Ann brings up a point that you didn't sort of get into, is there's obviously a barrier to entry to a testing regime like you've got. I'm sure this had to hit the pocketbook of your organization. And can you give us some insights on that, and maybe some lessons learned for folks that don't have a regime like this that could sort of help them try to stay within their budget, which is so challenging in these times?
So Steve, this is a great question. Okay, when we initially started this, LabCorp was charging us the CMS reimbursement rate, which was $53 for testing. Okay, and but you have to remember that this is a medical test that has to be ordered by a physician, and our medical director was deeply involved in every single testing decision, right? Because it was his name that was on those lab slips. But what we didn't do early on is we didn't include the insurance information. We didn't include the insurance information for those residents who, for example, have Medicare as their primary insurance. We didn't include the insurance information for our employees who have Kaiser or other types of insurance. And in the future, if you're getting ready for COVID 2.0, get those labels ready to roll. So all you have to do is take sticky labels off and put them on those lab slips, and you'll save yourself, because then the billing for that will go to the insurance companies and you don't have to deal with it. Now we're digging out of a hole. We've spent over $100,000 in testing. Now, LabCorp has been very patient with us, and ultimately the insurance companies who insure my employees and my residents will pick this up, and LabCorp has not inflated the cost of the tests at all. But today, the test from LabCorp is $100, which is the CMS reimbursable rate the last time I checked. So they've been a wonderful partner for us. And, but I would encourage folks out there, get those labels and get your processes together now so that you're ready the next time COVID starts to rear its ugly head and you start doing the type of mass testing that we were doing.
Great, thank you. Okay, Ralph Scalar, he is another elder in our community that is just super involved in trying to get the enemy. He asks, have you considered other types of testing for visitors or workers that could be done all the time? For example, automated tests for coughs and loss of smell. Ralph was actually instrumental in putting together a program for us a few weeks ago using the Aura Ring. And this is, it monitors health, and they're doing some studies that, where it can be a predictor. There's some, where you can sort of predict the COVID and the flu with some wearable technology. You guys are so tech forward. I didn't know if you guys are exploring some of the technology that could potentially be helpful.
So we are looking at a lot of different techniques. So we're partnered with AARP right now. We're also, we have partnered with a company that makes a kiosk. When you go into an airport, you get screened with a kiosk now when you come back from a overseas trip where you've left the United States. You come back in and you've got Homeland Security, Customs and Border Protection. You have these kiosks where you come in, take your temperature, where you've been, you fill out the paperwork. We see in the future of senior living kiosks where when you come in, it not only is asking you questions, it's taking your temperature, and that information is being fed digitally, not only to payroll systems, but to my clinic nurse to alert us anytime somebody comes in with potential exposure. We've been doing that with people, but I think to some degree that in the future, that'll be a digital solution. And I can't wait for some of the best and brightest minds in America to put their focus on this. And I believe we're working with companies already in this area. And I think in the future, there will be other technologies, and we're eager to test them at Knollwood.
Wow. Well, I'll tell you what, like, as you begin going through that, if you want us to convene another meeting like this where you can share some of the things you've learned, I know that would help a lot of people. Let's see, Catherine McCallum has her hand raised. Catherine?
Yeah, thanks, Steve. Colonel Bricker, there's a wealth of information now that you've learned in the microcosm. And I have a couple of questions. One is, people are hesitant to put their family members in skilled nursing facilities, assisted living. A lot of it has been put on hold. How are you all faring in terms of new residents? And what would you say to persons like myself who advise families on care, and they need that elevated level of care? What kind of comfort can we give people that going into facilities is going to be okay?
So it's a great question. It's a real question. Every day, more people, we're not getting any younger. And with COVID, it's introduced even more fear because to a large degree, these folks are so vulnerable. So first thing I'd look at is are they a 5-star campus or not? You either are or you're not, 4 or 5 stars, because those are quality indicators, and that's a commitment to quality over the long term. Second, I would definitely be interviewing the director of nursing. I'd eyeball the leadership to, you have to make an assessment, and then they better be testing. And I'd want to know what's the rate of COVID infection that you've had, not only in that with your residents, but with the staff, because we've separated our staff now. We don't have staff serving in all three communities. They're either in independent, assisted, or long-term care and skilled. So and I'm sure there's other communities out there that are doing something similar. We provide wonderful care to our residents, and we continue to have folks that are coming into admission for long-term care. And we've contained it, and we haven't had any for 9 weeks. And we're in Washington, D.C. We're surrounded by some of the highest COVID rates in the nation. Okay. You can't argue with those facts. And so you're either disciplined and you're aggressive in infection control, or you're not. And if it were my mom or my dad, I would be personally involved in making a very educated assessment before I would bring them into a community like this, because to a large degree that these are the most vulnerable. We know this. And so that's why we don't allow visitors. We haven't. And this is hard on the residents. But the reality is they continue to live, and we figure out ways for them to communicate with their family, whether it be Zoom sessions. But until we have a vaccine, this is the new normal for those of us involved in caring for the elderly.
Thank you. And one other quick question. You've dealt with this in a large, small model. Just for community larger concerns, how would you advise the leadership on the larger level in terms of, my fear is that we're not going to have enough testing locally, state-wise, nationally. You say everyone needs to be tested. And now I'm looking at for the care of our loved ones, but also beyond. How would you advise our leadership? If you had a one-on-one, you've got the CDC, you've got, local leadership, testing, yes, but is that the only thing you would say that absolutely has to happen out of your experience to support the care of our loved ones in the retirement community, but beyond? If you became in charge of that stockpile, for instance, what would you say? It's a larger question, but just curious, since you're a colonel.
I'm way out of my lane here, but I would just give you this as context. So we've mobilized literally hundreds of thousands of men and women to fight wars abroad. We've spent trillions of dollars fighting wars abroad. Now we need to take care of Americans, and we need to leverage the very best and brightest minds in our universities and in our laboratories and in our in industry. And we need to make this a national emergency, and we need to figure this out. And then once we do, we can share it with the rest of the world. But we need a unified effort, and we need everybody on board. That would be the way I would, that's the way I would handle this.
Very well said. And thank you, Catherine, for your contributions. And I'm going to get to a couple of other questions Catherine typed in, but here's a really good one. It says, how are you handling food service? Are you feeding in common areas, dining rooms? How have you adjusted to meet the need of socialization?
So no, we allow, we didn't allow this until literally the middle of June. We allow the residents to eat outside now. We have outdoor dining, but we shut down our common interior bistro, and we've provided free room service to the residents, and they've largely eaten in their rooms. Now, now that's in skilled and assisted. Independent living folks, they can go out. We screen them when they come back in. They go outside and eat. But, we hear this every day from my independent living residents, that they say, why would we leave when we're the best protected right here? We know we're safe here because we get tested. We know the staff is getting tested. You're very transparent with us. We have everything we need right here. And so we've just had to figure out new ways in which to provide those essential services.
Man, sounds great. Now you'd mentioned going outside, residents going outside. Would it be possible for families to visit and be socially distanced outside with protection in the residence?
Absolutely. And we've started that for independent living, and we will unveil adult family members visiting independent living residents here in the near future, but we still do not allow any visitors in assisted living or skilled. We have set up some visits at a distance in assisted living where we'll put a resident on a balcony with a family member underneath them. We've seen these pictures of people communicating through windows. So we're always looking for new innovative ways to leverage technology in order to allow family members to stay in touch with each other. But I'm not going to lie, this has been hard on everybody because out of an abundance of caution, even family members, you know, they're just worried. Everybody's worried. And this is another thing testing does, okay? Testing provides a great amount of psychological wellness to people because then they're informed. They don't have to worry. Now, that's only as good as their last test, but as long as they're careful with their patterns of life, you know, they can there's a better probability that they won't have contracted the virus, you know? So it just informs them and gives them with knowledge, and people would like to know, and testing helps them understand if they're positive or not for the virus.
Carolyn Kukerman says about contact tracing. How is this accomplished?
So I'm going to let Margot talk about contact tracing because you know, this is nursing stuff, and I really I want them to talk about it.
Okay, so I'm in charge of the testing for the staff and the independent living residents. And contact tracing for us, when there was an independent living or a hall staff member that became positive, we spoke to their manager, their director, to find out what their patterns of living were during the work hours. And then we developed a questionnaire and we asked the staff member themselves to answer these questions. So we got a good idea as to who they were around. Do they live with anyone that has had COVID? And recently, when we had someone test positive, I spoke to their manager and they told me every resident that person had visited in their apartment. And we had to contact all of those residents, and none of them were symptomatic, but we tested all of them all in one day. There's like 30. And all the tests have come back, they're fine. And so contact tracing for us means that we speak to the manager for that particular staff member, and we find out who they've become in contact with. And then we also ask a large amount of questions for that staff member to find out what their patterns of life are outside of our building. And so that's basically what I do. And I know that the skilled nursing facility and the assisted living facility probably go more into depth, but hopefully that answers your question.
Great. Let's see, Dorcas Baker has a question here. My aunts live in a large assisted living facility which believes in testing only symptomatic residents or employees. They have had no positive cases based on this, which we know is not correct. Staff wear masks. What is your recommendation for facilities that do not test nor have testing kits available? I think we know your position on that, but you know, I think any words of wisdom to a community or a provider after hearing this talk, you know, it'd be interesting to hear what the resistance is. I know there's a financial commitment and a staffing commitment, but when you see the results, it's hard to argue with this.
So I'm going to start, and I'm going to turn this over to Arlette. So physical distancing, okay, maintaining that 6 feet, and masking and keeping your hand, you know, everything the CDC's told us from day one works. You know, when I have an employee who comes up and the employees go home and they go to stores to shop, I've got a lot of single moms, they have to take care of their families. And so I've had an employee recently who came up hot with the virus, and we called and literally talked to him, and we walked through his patterns of life for the last week. And it was almost like you know, don't take this the wrong way, but I'm not afraid of an inquisition when it comes to understanding patterns of life, because I really want to be able to nail down where they picked it up. Okay. And then if they've been wearing their mask and they've been wearing their gloves and they've been practicing social distancing, then what we found is that they can contain it. So it's not spreading. So everything you're hearing works. Okay. So I just want to reiterate, it's really important when it comes to social distancing, wearing your mask, making sure you're wearing it over your mouth and your nose. And then the staff has to be self-disciplined about, if you have symptoms, don't come to work. Okay. And then your screeners have got to be literally, they cannot be just some employee that picked this up as an additional duty. They've really got to be sharp. They need to be trained. And then there needs to be spot checking of the folks doing the screening, because those screeners, those people are crucial because they're controlling, they're your first and last line of defense on folks coming into your community. So the questions and the temperature, I mean, we've turned away employees, we've turned away contractors who answered the questions that said, have you been exposed to anyone with COVID in the last 14 days? Or we take their temperature and it's above 100.4. Stop, please leave immediately and get medical attention. We believe you may have contacted the virus. You need to get tested. So Arlette, anything you want to add?
You answered all of it, sir. But if you don't have the capacity to test, you need to consider everyone in that community as potentially COVID-19. And what would you do if you were next to someone that you think has the COVID virus? As Connor said, is wearing your mask, is washing your hands, and doing everything that the CDC is saying. Yes, we're blessed to be in a community where we can have that information, the information of who potentially has the virus or not. But if you're not testing, I can assure you, you have some asymptomatic in your community that you don't know about. And that's the great danger about this disease. So wearing the mask and people being diligent and the directors and the co-workers making sure that if they see someone without a mask and just stopping them, please wear your mask. If someone is not washing their hands the way they're supposed to, stop them and teach them how to wash their hands, and then social distancing to reduce the potential of having this virus spread.
Great answer, Arlette. For those providers that may not have leadership like Knollwood, I think Arlette's words of wisdom on, then you've got to assume everybody is COVID positive, and how are you gonna react in that situation? Let's see, we got a few more questions. I know it's about 1, but we're gonna go a little bit over to just get through these. Let's see, I've seen in chat, there's several questions about how you all are, what is your PPE supplier? Would you be willing to share those resources? Because I guess some people are not as successful in getting a good supply of PPE as you are.
That's a question for Arlette.
Oh, sir. We have, thank you. We have 2 great gentlemen that are working tirelessly to find any source for our PPE. I don't have exactly their suppliers, but I'm willing to share that information. I can send it back to you.
Okay, great.
Steve, let me just jump in there quickly. So there's unfortunately folks out there that are trying to scam in PPE. We've run into it. So you really do need to look at your supply source. We got scammed a little bit because we were so aggressive, and we were literally going globally to get PPE early on. We were trading PPE with Sibley Hospital in Ingleside in the middle of the night because we needed to get ready for testing the next day. It really was a collaborative network approach with the administrators, the directors of nursing, sharing information and helping each other. It was truly a collaborative team effort for those of us in this business. And so, but now that we can reset and get prepared for the future, now's the time to really look at your supply chain and make sure you can count on it. Folks, if you can't count on your supply chain right now, you need to replace it. because you don't want to get into this dilemma again this fall.
Good words. Now, I know this is a good, again, Catherine McCallum asks, is there hazard pay for any staff on your team? And I know this is something that's coming up in the school systems is, and well, it's a question.
So short answer, while we had COVID in our community, I was paying special pay. Again, so this financially, this has been hard. Had we not been, early on, we were successful in applying for the Paycheck Protection Program loan. And that's really been the bridge that's enabled us to do this, because we did pay. I mean, there were times when I literally would have 2 nurses taking care of my residents because I had 5 or 6 CNAs per shift that were home sick, right? Or 3 or 4 LPNs. And it was rough going. So I was paying extra for the folks that were closest to COVID. And we paid at one point in my one ward where I had the most cases of COVID, I was paying a 50% surcharge, okay? I was having problems getting temporary workers, and there's nobody like your own when it comes to taking care of your residents, okay? You can't pay somebody to care, and our people care, and this was personal to them. And so we just made it, and we talked to our board, and we said, we're gonna deal with this, and we're gonna pay these people because they're incredibly skilled, they're valuable, and they're willing to put the PPE on and go in and literally face down death when they were taking care of residents with COVID. Okay, these are single moms going home every day. And so, yes, we did pay them. It was expensive, but they're worth every dime.
Man, and you sort of touched on this. Heider had a question. What strategy did you have in place to ensure appropriate staffing when your staff were identified positive through testing? And I think you've elaborated on that a few times.
Yes, so this was a crisis. This was April. April was rough. We had brought in additional healthcare workers. We got temp agencies. We have a relationship with Capital City Nursing. We have a relationship with Life Matters, and they definitely helped. But this, just like PPE, you really need to make sure that you assess a source of workers. But healthcare workers are a precious commodity, and we have to figure out a way to ensure that they're taken care of. When I say taken care of, that they're paid appropriately. And when these are the folks that go in and they work in these areas where COVID is everywhere, right? So when you get a community that gets affected, that area needs to be isolated immediately. And then all those folks that are in there and working in there, they need to be assumed that they're positive. And so for some of those folks, they had to go home immediately. And we were moving workers from different parts of our community. And fortunately, we have a wonderful community here, and we have a wonderful team, but it wasn't without its challenges. And this is going to continue to be a challenge for those of us involved in senior living.
Yeah, great. Okay. And we're trying to wrap up here. A few more questions. Brian Miller has a good one. How are you notifying and updating the resident family members on the testing frequency and the results? And what is, the interaction that you're having with family members and keeping them in the loop in these challenging times?
So boy, that's another great question. So we communicate with our residents and our staff with written, what we call operational updates. Okay. We also, we communicate with the different communities a little differently. Okay. So my administrators focused on skilled and assisted living, and my director of assisted living, she focuses on communicating with the residents and the families of assisted living. The boss and I produce operational updates, which are a collaboration that shares what's going on, and as well as what's going to happen in the future and what the policies and procedures, any changes are. And we do that in writing so that it goes out in a written form. Initially, we were doing sessions that were verbal, but we have residents that have a hard time hearing, so we put everything in writing. And then we translate that into Spanish for our workers so that there's an English and a Spanish version, because there's so many Latinos or non-English speakers that are working in healthcare today. And additionally, we do conference calls with families. So we get the information out to the residents first, but then we also opened up a line to do Zoom sessions with families. We would have 100 to 150 family members on our calls, and we would share with them what's going on and what we're doing. And we just wanted to be as transparent with them as possible. In a crisis, you cannot communicate enough. If you have leadership that's hiding, they're in trouble. You have to over communicate when you're in a crisis.
Great. Okay, a few more here. When you do your mass testing, do you go into the residents' rooms, and how do you test all employees in one day?
So we do both. I leave it up to my nurses where the testing occurs. We don't test anybody. Most of the employees are being tested outside, and most of the residents are tested in their rooms, or in their apartments, I should say. But Margot, anything you want to add?
So recently, when we had a positive staff member and we had to locate the residents that might have had some contact with that staff member, we had them come out to our patio under a tent, and we mass tested 30 plus residents, and it worked really well. But generally speaking, we test independent residents in their apartments. They usually meet us at their door. We're in full PPE. And for the staff, we do weekly testing now for all skilled nursing facility staff members and assisted living staff members, Monday in the morning, Tuesday in the afternoon, and Wednesday in the afternoon as a makeup day. And we have tents set up. And when we did have a couple of positive staff members a month or two ago, we would have them drive up. We didn't want them anywhere near anybody that was just tested, that was just standing there. So basically for independent in the apartments, and for staff is outside.
And one other thing I'd add, Steve, is if it's an employee who's coming back who's recovered from COVID, they've been fever-free, they followed all the CDC guidelines, we require 2 negative tests with 24 hours in between before they come back to work. So we're following those same protocols that the CDC has told us to follow. And Margot and her team have done yeoman's work when it comes to testing, but I've literally almost had to create a testing squad for Margot because it consumes her with the work. And because you have workers on 24/7, right? You got to do testing at various times so you can capture folks as they're coming off or going on. So it is a full-time operation, and I've asked Margot to pick it up, and she's done a great job.
One other thing I would like to add, when we first tested all of the independent living residents that were still living at Knollwood, because a few went and lived with their families nearby, we developed teams of testers. And so we would have a tester and an assistant with their cart and their PPE, and they would take the first floor. Then the next team would take the second floor. We had 2 teams on the 3rd floor and another team the 4th floor. So we did all of the independent residents back in April, and it took us about 4 hours. But it worked really well.
Wow. This is, Winoka has a very good question, especially in light of your comments about many of your staff being single parents. How are you preparing for staffing issues that may arise due to school reopening, either partially, completely, or virtual?
So it's a great question, Steve, and I don't have the answer here, other than we take care of the people we have. We're out making sure that our PRNs and our part-time workers are trained and they're available. But one of the things that we learned quickly was the staff appreciate knowing that they're going to be, that they're more than just a staff, that they're part of a family. And we treat everyone here like that. So if I think anybody's been exposed, I test them. That provides such psychological wellness, not only for the residents, but for the employees to know that they don't have the virus. They don't have to wonder or worry about, do I have it or do I not have it? So, they know we're committed to their welfare. We don't mess around when it comes to taking care of our people. And it's one of the reasons that most of the folks are on our team, they stay they stay a long time because they really feel part of our Knollwood strong family.
Man, guys, I am just blown away. This was so informative, and I recorded this. I'm going to send it off for transcription because I think what you shared with the community of providers and elders is very inspirational and very informative. And I like you guys, really want to get the word out. And I know that this conversation will inspire others. I can't thank you all as much for being so transparent and taking time out of your day to talk to us, and you're all heroes. And so I want to wrap this conversation up. Any sort of closing remarks that anybody would like to share?
So I want to see if Margot or Arlette, do you have anything?
I just want to say thank you again, Colonel Bricker, to our leadership. You guys have been so amazing, and it's very evident that you care for everybody that lives here and works here. So thanks again.
That's great. All right, guys. Again, thanks so much. And I will follow up with all the attendees with a recording of this, the chat transcript. And like I said, this is one of these sessions that I'm going to have an actual transcript of this recording so you can share it with your colleagues and staff. So we'll see you in Knollwood. Anytime you want to come on and share what's going on over there, you have an open invitation. We'll put together the audience for you.
Thank you, Steve Gurney and your team, for providing us this opportunity to share what we've learned. And hopefully those that are out there in the audience found it useful. And we're glad to continue sharing, because this is going to take a collaborative effort as we get ready for COVID 2.0. It's not over.
Yep. Okay. See you soon.
Thank you.
Thank you.